Hey, good morning, everyone. My name is Seth Campbell. For the splinting assignment, I'm going to be going over suspected lower arm fractures. So you have your radius and your ulna in your arm. I say suspected fracture, right? In first aid, you're not here to diagnose anything. You're just treating the signs and symptoms. So some of the signs and symptoms that you are looking for is going to be an obvious deformity is going to be a dead giveaway. Contusions, so that's bruising, tenderness, swelling, crepitus. So if you hear like crunching, snap, crackle, pop, any of those in the bones, then those are going to be your signs and symptoms. Some things you may look for as well is like guarding. So for guarding, it's if a person's holding their arm like this, right? They're doing it for a reason. Also, if you ask them to move it, so like motor function, if you're like, hey, can you move your arm, and that's extremely painful, then it's potential for a fracture. Some of the mechanisms of injury that you can look for. So somebody falls and their whole body weight's going onto their arm or hand. That's potential for it. Blunt trauma. So if an object strikes it, you could cause a fracture that way. Any sort of crush injury, something falls on it, things like that. All right, so for the splint that I like to use, it's called a SAM splint. I didn't realize that the video in the readings was the same thing, but I'll go a little bit more over SAM splint. So this is a SAM splint. They're super versatile, pretty inexpensive. I've got a couple of them myself. There's directions on them, which it's going to be reversed because I'm using my camera video. But right here it shows you directions on how to splint an arm. There's two different ways. You can do like the taco method, which is where you wrap it around the arm with the bend around the elbow, and that's going to help prevent any sort of movement while in the splint. And then you can also double it up if you need a little bit more rigidity. These are pretty rigid, but they're also just like a thin metal film in there. They're pretty malleable. This one also shows you how to splint a leg if you need to do that. They can be used for lots of other things as well. So say you needed to splint like a finger or something like that, and you got some trauma shears, you can actually cut through this pretty easily. Things to look for when you're cutting through this, it's got that little metal inside of the padding. So if you do cut this, you're going to want to tape over that just so you don't have any sharp metal parts when you're splinting it. But super versatile, they can be used for many things. So for first aid, important things to note: make sure you have your PPE. These are standard latex gloves, right? So make sure you have your PPE to protect yourself. Ensure that the scene is safe. If you're at a sporting event or something like that, scene is usually safe, but always check for scene safety, number of patients. See how many people you're working with. Make sure that you can handle who needs attention first, and then get consent. If they're unconscious, you have implied consent. However, if they're conscious, hey, is it okay if I check you out, see what's going on with your injury? And then if you're able to, and as long as it's appropriate, expose the injury. If they're wearing short sleeves like I am, obviously you can see, but if they're wearing like a long sleeve shirt, you may need to button it back. If you got some trauma shears, cut it open just to see if there's any exposed bones or any bleeding or anything like that. You want to control that before you splint it. If there is any bleeding, use a clean sterile cloth, gauze, some sort of dressing. Apply pressure to stop the bleeding, and then go ahead and splint from there. Also, like myself, if they're wearing rings or a watch, go ahead and remove those rings or watches, because if you get swelling in this hand, now that ring is going to be engulfed by the finger and it's probably going to have to be cut off. Same for watches. Any sort of swelling that can restrict blood flow, prevent circulation. So remove any sort of jewelry that they're wearing if they have some sort of injury, because that swelling could affect that. And then you're going to check for, the way I learned it, it was called PMS, Pulse Motor Sensory. I believe in the readings it was CSM. They're synonymous. They mean the same thing. It's just an acronym that's differently, right? So PMS, check for radial pulse. Whenever you're checking for radial pulse, use your two fingers. Don't use your thumb. Your thumb has its own pulse. So obviously, if this person's talking and breathing and has an arm injury, they should have a pretty present pulse. But if the pulse is absent, then at that point you have some sort of restriction in there, and they need to go to a higher level of care pretty immediately. So you're checking for pulse, motor skills. So hey, can you open and close your hand? Can you make the OK sign? All right, good to go. Right, their fingers work. And then you're grabbing. Hey, what finger am I touching? Right, can you feel me touching these fingers? Something you can do, so you can do 2 steps at once. You can go ahead and check PMS, check for pulse. So cap refill, squeeze the finger, it should turn white and then turn pink again within 2 seconds. So while you're doing that, you can say, hey, what finger am I grabbing? Okay, index finger, let go, cap refill's good. So now you just checked sensory and pulse simultaneously. And then once you check that, you can go ahead and start molding your splint. So most people are anatomical, they have 2 arms. So rather than checking the injured arm, you're going to measure on the non-injured arm, right? So if you're doing the method where you fold it over here, go from there, you can kind of form it to the arm of the good arm, and then when you switch it over here, right? Say you want to splint the injury above and below, so you want to immobilize this joint, and then we're going to immobilize this joint later. If it's a joint injury, say it's in the wrist, then obviously you can just immobilize it here, so you've immobilized above and below that joint. So have that there, and then we're going to use some sort of elastic bandage, ace bandage, something like that. Go through, and you want to wrap it above and below the injury. Let's see if I can do this one-handed. You don't want to put this on too tight, restricting blood flow. Then most of them have Velcro. You can secure it with Velcro. If you're unable to secure it with Velcro, you can just kind of tuck it in. So that's there. That's secure. It's not going anywhere. It's not too tight, right? I can get in there. This is elastic. So once you've done that, you want to splint it in the position that you found it, to the max extent possible, depending on your level of training. So and your local protocols. So if you have any sort of EMT training, paramedic training, things like that, and it is within the protocols in your local area, and say it's a deformed injury out of an anatomical position, and you don't have any PMS, right? You don't have any cap refill, you can't feel radial pulse, they can't feel you when you touch their fingers, then you can attempt by pulling, we call it traction, so gently pulling on it to put it into the correct position. I wouldn't attempt that more than one time. If you're unable, splint it in the position that you found it. If there's no PMS, then you're gonna get to a higher level of care swiftly. So try to get there immediately, because they're gonna need some sort of medical intervention from probably a surgery. But at that point, you've identified the signs and symptoms, and you just need to transport, splinting it in the position that you found it. So once it's splinted, everything's in there, you're going to recheck PMS, right? So same things, hey, can you wiggle your fingers? Can you feel me touching that? Cap refill. If you can get in and feel pulse, but cap refill is going to be one of the same indicators. So going forward, we did that. We used the opposite arm as a template. I tied this beforehand because I wasn't going to let you guys watch me attempt to tie this one-handed. So this is a triangle bandage. There's a knot here where the elbow goes, and then tied behind the neck. So what you're going to do, feed that through. And so now you have immobilized this joint as well, this joint down here for an injury in the arm. This basically just gives them something to hold on to with the vent down here, a little bit of extra padding there, and then at that point you could take an additional bandage, wrap it around to keep this tight against their body. That way, when you're going somewhere, it's not bumping off their body. So if you have an additional bandage or elastic bandage or even an additional cravat, you can secure it to their body so everything stays tight from there. And then if there's any sort of swelling, you can apply ice. Once it's wrapped like this, you can just take a cool pack and set it directly on here to prevent any sort of swelling. Don't leave it on for more than 20 minutes. Don't apply the ice directly to the skin. If the person's not already sitting, put them in a seated position. If they're more comfortable laying down, let them lay down. Just place them in a position of comfort. And that is, they just went through a pretty traumatic experience. So if they were to pass out with this injury while they're standing, they're going to fall on it. Could create further injury. And then if you've got any sort of wool blankets, jackets, anything like that, put that on there just to prevent shock from setting in. Or if shock is setting in, slow it down just a hair. Some things that I've got. These are just like a standard space blanket, right? But you can use a wool blanket or a jacket or anything like that to keep them warm, to treat for shock. And that's all I've got. So just to go cover a few things. Always wear your PPE, scene safety, number of patients, give consent, check PMS or CSM. So I'm checking for pulse, motor, sensory before the splint and after the splint, just to make sure whatever interventions you put in didn't cause any issues afterwards. So got that. Same splint. You can use it for lots of things. Super versatile. And then secure it, not tightly, just enough to keep it immobilized. An additional way you can use this for an arm fracture, right? Taco method. So it's going to go around here. Same thing. They're going to grab, put it over, and then secure it that way as well. Always measure on the opposite uninjured limb, just so you're not manipulating the injured limb. You want to keep it immobilized to the max extent possible. And that's all.